So before I start and go in, I am going to make sure I have a doctor's order to insert a catheter into my patient, and I'm making sure that I have all my supplies. So I have the catheterization kit, a 10 milliliter syringe, a stat lock, and then clean gloves, hand sanitizers, and then a basin with warm soapy water and a towel and a chalk. Okay, so knock knock. Hello, my name is Helen. I'll be your student nurse for the day. How are you feeling? Good? That's good. Okay, so then I heard that you have trouble urinating. Yeah? Okay, so then there's a doctor's order for me to insert a urinary catheter. So we're just going to do that for dirt now, okay? Okay, and have you had this done before? You have? Okay, so then just a quick rerun of it. I'm going to clean your perineal area, and then I'm going to insert your urinary catheter that will drain your urine, okay? And you're able to move with this and stuff like that. And then when it's time to remove your catheter, I will know because your doctor put an order in for it, okay? Okay, so before we get started, I need to get your date of birth and full name. Jane Doe, December 12th, 1996. Okay, perfect, it matches. Any allergies? No allergies? Okay. So then before we get started, I'm just going to clean and prep, and then we can get going, okay? Okay. So the first thing that I will do is I will close the curtains for privacy, and then I'm going to hand sanitize. And then I'm going to clean my surfaces. So I am going to clean this wipe for 30 seconds. I'm going to wait 2 minutes for it to dry. Okay, and then I will also wipe this one, and I'm going to wait 2 minutes for this as well. Okay, I'm going to throw it away, and then they'll dry. So this way, and then I will do hand hygiene one more time. And then I'm going to put all my supplies onto the table. So the device, the kit, the chuck, the basin and towel, and then the stat lock, and then the syringe. Okay, so then now I'm going to clean my hands one more time. Okay, so Mister, we're going to start on cleaning your perineal area with some warm soapy water. So I'm just going to uncover you with a blanket, and then I am going to clean my hands, put on gloves. I'm going to make sure you're in supine position, and then I'm going to externally rotate your legs so that there's space in between your legs, okay? That, perfect. And then I'm going to put a chuck down. And it's just so your bed doesn't get wet, okay? Okay. So then, now that we got that down, I'm going to take off these gloves. And then sanitize. And I grab the basin with the towel. So just tell me if you ever feel uncomfortable, okay? So I'm just going to dip this in. I'm going to go inside out, okay? So front to back, that, front to back, inside, and then front to back, outside, and then to back outside. Okay, now it's all clean, so I'm going to clean this all up. Take off my gloves. So first, I'm going to sanitize my hands. And then now I'm just going to open up the kit. Throw this away. Okay, so it opens. Edge, the edge, the edge. We have this. We won't be needing this. I'm going to throw this away. And then here are our sterile gloves. So now I'm going to drop the 10 milliliter syringe for the urine. Okay, throw that away. And then I'm going to drop in the stat lock stuff. Okay, throw that away. And then I'm going to grab the sterile drape by the edges and then put it Chinese side down. Okay. So then now I'm just going to re-sanitize. And then I'm going to open up my sterile gloves. Do it from the side. Okay. 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 So I'll throw this away. So then now I am just going to put the urine syringe on the side along with the cup to catch the urine. And also the stat lock stuff over there. Then next I will attach the sterile water to the balloon port. Okay. And then I'm going to take the plastic off the tip of the catheter and then get the loop, throw this part away, and then insert it in. Okay, and then leave it for now. And then I am going to get this stuff. Okay. This is the antiseptic iodine solution, so I'm just going to pour it in. Make sure the cotton balls are all soaked with it, and then throw it away. And I'm going to carry all this stuff over. So put it right there, and then you can go like this too. Okay, so this step we're not just going to clean your perineal area again, but this time with the iodine solution. So we're just going to have cotton balls soaked in iodine, and then they're just going to be cleaned from outside in, okay? So I'm just going to hold on to it. So outside in, or outside front to back, pull away, and then around, and then drop to the trash. Outside, front to back, pull away, and around to the trash. And we're going to go inside, front to back, pull away, around to the trash. And then inside, and then pull away, around to the trash. And then now we're going to go down the middle. Okay. Now we're just going to put this stuff away. So then now it's time to do the urinary catheterization. So when I do it, can you start taking deep breaths for me? Yeah? And then let me know when there's like unbearable pain, okay? Just tell me how you feel. So the first thing I'm going to do is I'm going to grab the catheter 2 inches from the tip. And then I will insert it when she breathes out. So ready? Take a deep breath. Okay, and then I see urine, and then I'm going to stop. So then I'm going to advance 2 more inches. 1, 2. So then now I'm going to get this. I'm going to inflate. Okay, and now it's in. So then I'm just going to gently tug. Okay, it's all good. How did that feel? Not that bad? Okay, that's good. Okay, so now, I'm just going to put this away. We're going to need to get a urine sample from you just to make sure that nothing's too wrong, okay? So first thing I'm going to do is I'm going to wipe this port with the alcohol wipe. And then let it air dry, and then I'm going to grab the sterile urine syringe that we unpacked earlier. And then I'm just going to carefully twist it in. I'm going to kink it right below the port just so we don't get urine that's from the bag, so we get fresh urine. So I'm going to get at least 5 milliliters. Perfect. And then twist. Okay. Good. I'm going to put this away back onto the sterile table. And so then now I'm going to do a stat lock, okay? So let me take this all out of here. So the stat lock is just to help keep it in place. So let me just do that, and then perfect. I'm going to tape it onto your upper thigh, alright? And I'm making sure that there's enough tubing so you can move around without it pulling, okay? And then I am just also going to hang this bag on the bed because it'll be below the bladder. Okay. Just so it's there. Okay, so then right now I'm just going to take this out. I'm going to clean up a little, throw this all away. Reposition your legs back. Okay, and then put your blanket back on you. And then now I am going to take off these gloves. I'm going to sanitize my hands. Okay. Then I'm going to open this up. And then I'm going to squirt it in. Slowly, just so it doesn't splash everywhere. And then throw this away. Put this on tight. I'm going to label it with patient name, date, time, and the MRN, so medical record number, and send it to the lab. I'm setting this up. Lab. Sanitize. Okay, so that was it. It wasn't too bad for you, was it? No? Okay, good. So, if we finished, and if you need anything, just let me know. Press the call button, okay? I'll be here as soon as possible. Alright, okay. So I'm going to leave the room, I'm going to sanitize, and then I will document date, time, how the patient tolerated the procedure. So she did pretty well. She had no pain. It went in pretty well. The size of the catheter we used, so 14 French, and then the urine, it was yellow, it was clear, it was straw. Last time I checked the Foley bag, already 15 milliliters were in there. I also put in 10 milliliters of sterile solution or sterile water into the balloon to inflate it. Okay, so before we start this procedure of removing the catheter, I'm making sure that I have a doctor's order for it and that I have all my supplies, so a truck, 10 milliliter syringe, and clean gloves. Okay, so knock, knock, knock. Hi, Miss Joe. So, how are you feeling today? Good? Good. So I just received an order from your doctor that today is the day to remove your catheter. Yay! Yeah, so it'll give you a chance to use the bathroom on your own and see how it goes, okay? Okay, so before we start, I need to know your full name and your date of birth. Jane Doe, December 12th, 1996. Perfect. Do you have any allergies? No? Okay. So first, before we start, I'm just going to get everything prepped and then we'll get started, okay? Okay, so the first thing I'm going to do is I'm going to close the curtains for privacy. And then I will sanitize. And then I will put on gloves. Okay. I'm going to undrape her, like take the blanket off of her. Alright, I'm going to make sure you're in supine position, and then I'm going to externally rotate your legs, just so that there is some area in the middle here. Perfect, and then I'm going to put a chuck down. Okay. Okay, and then I'm going to get some type of like alcohol or like water to remove the stickiness, so it's off, and I'm just going to take this off just where it doesn't weigh it down or anything. Throw it away. Take these gloves off. And then I'm going to hand sanitize, and then I will put these ones on. Okay. Alright, so first I am going to get my 10 milliliter syringe, sterile syringe, get that. I'm going to attach it to the balloon port, and I'm going to take out about 10 milliliters. We want 10 because on the chart it was charted that 10 was put in, and we want the same amount taken out so it is fully depleted. So not exactly 10, so I'll just go in again and redo it. Pull some more. Okay, perfect. Okay, now I'm going to discard this. So I am now going to remove it, okay? And I want you to take a deep breath. And when I remove it, I'm going to ask her to take a deep breath, and then I'll remove it when she blows out. Okay? Deep breath. Okay. That wasn't too bad, right? No, it really wasn't. Okay. So I'm just going to go quickly to the bathroom to measure this and discard it, okay? So I'm going to the restroom, and I'm checking, and it is about 300 milliliters in here, and so I will remember that to document later. I'm going to discard this. Come back into the room, take off my gloves, clean my hands. Okay, and then I'm going to reposition your legs, and your blanket is on you right now, okay? So that wasn't too bad, right? Removing? No, okay. And so when you do have to go pee or void the next time, just press the call button, and then I'll be here because I just want to make sure that your bladder is working properly and that you're fully emptying your bladder. So I want to measure it, how much you void. So in the toilet there is a hat that will catch your urine, and I can look at it and measure it. And if there's any problems while you're voiding, just let me know. And some stinging and some burning may be possible in the first couple of voids, but it'll go away and lessen over time. And if you haven't urinated or called me in 6 hours, I will bring a bladder scanner over here just to check your bladder, okay? Any more questions for me? No? Okay, so I'm going to leave you, and hope you have a nice rest of the day, okay? Okay, so I'm going to leave the room, and I will sanitize. I will document the date and time, how my patient tolerated the removal of the catheter, and she did pretty well. There was no resistance, there was no pain. The urine that was in the bag, it was clear straw, 300 milliliters, and then when I deflated the balloon, it was there's 10 milliliters out, so the same amount in and same amount out. And so the next two voids, I will also document these same characteristics as well.